Hi, my name is Karen Harden. I'm a physical therapist who may be treating you during your stay at University Hospital. The purpose of this video is to help you better prepare for your joint replacement and explain what to expect from physical therapy during your stay. The definition of physical therapy is the use of specifically designed exercises, modalities, education, and equipment to help you achieve your optimal level of function. Now, physical therapy will start on the day of surgery, depending on the time that you arrive to the floor. Your physical therapist will check with your nurse to ensure that your vital signs are stable prior to getting out of bed. Now, the length of stay is typically 2 days. You'll receive physical therapy daily until your goals are met. After your goals are met, you can walk in the hallway with your family. Most patients will discharge with continued therapy either in outpatient therapy or with home health. After surgery, you will have weight-bearing precautions. A weight-bearing precaution is a limitation on the amount of weight that you can bear through your operated leg. Now I'm going to demonstrate different levels of weight-bearing precautions. Weight-bearing is tolerated means that you can put as much weight as you can tolerate through the operated leg, and you are encouraged to do so. So, if my right leg is my operated leg, then I'm going to move the walker forward, place the right leg in front, and just bear as much weight as I can tolerate through the right leg. So just very minimal use of arms just to help with pain control. Now, partial weight bearing means that you can only put 50% of your weight through the operated leg. So therefore, you're going to be using your arms to take at least half your body weight. Now, if you want to check this at home, you can get out a scale and place your foot on the scale and see just how much half your body weight is, just to get a feel of that before surgery if you know that you're going to be partial weight bearing. So partial weight bearing, you bring the walker forward, then the right leg, then press through the arms, and then the left. So you'll see that you will be using your arms quite a bit more. Now, toe touch weight bearing or touchdown weight bearing means that you can only put 10% of your body weight through your operated leg. So that's a very minimal amount. You should check this on the scale if you anticipate that you're going to be limited to 10%. But if you don't have a chance to check it on the scale ahead of time, just think of it as placing the foot on the ground, and that is pretty much all the weight that you're going to place on your foot. So you're going to place your right foot forward if this is the operated leg. Take the majority of your weight through your arms. Lead always with the operated leg. Now, with toe touch weight bearing or touchdown weight bearing, you can put your foot flat. That's okay. But just make sure you're taking 90% of your body weight through your arms. After your hip replacement, you will have hip precautions. Hip precautions are movements that you need to avoid in order to keep your hip in the joint while the area is healing. There are 3 hip precautions. First, you do not want to cross your legs, not even at your ankles. Second, you do not want to bend your hip more than 70 degrees. Third, you want to keep your toe pointing straight ahead. You don't want to turn your leg in or out. And I'm now going to demonstrate these. My patient here has had a left hip replacement. Now we're going to start with moving your left leg towards me first because we want to keep your legs apart. I don't want to let you cross your legs. We don't want to cross the midline of your body. Okay? And you can just, now that your legs are apart, you can scoot your hips towards the edge of the bed a little bit. You can press with the other leg and just scoot yourself over a little bit. Good. All right. And push up onto your hands, your elbows, and then your hands. Good. And start to scoot yourself over to the edge of the bed. Okay. Now at this point we want to make sure that you're leaning back because we don't want to bend the hip past 70 degrees. So as you scoot to the edge of the bed, come out first with your pelvis. Scoot your hips out first. Good. Keep going. You're doing great. Okay. Getting to the edge. Get your feet on the floor. Now I'm going to put a gait belt around you, a gait belt or a safety belt. Now this belt we use just to make sure that you're safe when you stand up. So if you start to sway, we have a way to help hold on to you without pulling on your arms. Okay. So once again, the 70-degree rule at the hip, you cannot bend past 70 degrees. So you can see she's sitting on the edge of the bed. Now before we stand, the knee on the operated side needs to be straight. You can see that if the knee is bent, the hip is bent more. So if we straighten the knee, the hip is bent less. So with the knee straight, she can lean, we can bring the walker in, and she can lean forward just a little bit to stand up, not much. Okay? All right. And once again, before she sits down, you have to put the foot out in front so that the knee remains straight. Reach back for the bed and sit down. So that way we keep the hip bent less than 70 degrees. Okay, all right, we can stand up again. Notice the knee is straight. Okay. Now, as we begin to walk, that is when you need to be concerned about the alignment of your foot. You want to keep your foot pointing straight ahead. So we don't want you to pivot on the operated leg. You need to keep that left leg pointed straight ahead. So we're going to move the walker first, the left leg first, and then the right. Okay. Now, as we turn, you want to lift the left leg as you turn so that you do not pivot on it. So anytime you're turning around or turning to change directions, you want to lead with the operated leg in order not to pivot on it. Okay. All right, we're going to come back to the bed and I'm going to demonstrate some exercises. You will receive a joint replacement booklet. In the back of your booklet are exercises that you can begin before surgery to help in your recovery. Okay. I'm going to demonstrate these to you now. Okay. I'll let you hold. You can hold these. Okay. All right. So we're going to start with the ankle dorsiflexion. Okay. So that's ankle pumps, bending your ankles up and down. You can do both sides, up and down together, up and down. This exercise helps with your circulation after surgery to prevent blood clots. Okay. These exercises, we'll have you do 10 of these every hour. The next exercise are quad sets. That's gently tightening the muscle on the top of your thigh and pressing your knee towards the bed. So just tighten and release. Tighten and release. You should start with 10 of each of these exercises. So, okay? So just tighten and release. Okay. The next exercise is called heel slides. You're going to bend the knee and slide your heel towards your bottom and then back out again. Okay, and again. Good. Once again, 10 of these. The next exercise, hip abduction. That is basically just bringing the leg out to the side and back in. 10 of these. Okay. The next exercise is a straight leg raise. You're going to bend the knee on the opposite side. So you can bend this knee. Now, if this is the side that you're going to have the operation on, you're going to keep the knee straight and lift the whole leg up to about right there, and then back down. And 10 of these. Good. The next exercise is called gluteal squeezes. The gluteals are the muscles on the back of your behind. So you're just going to tighten the muscles on the back of your behind, like you're trying to tuck your bottom. So you just gently tighten the muscles on the back of the behind and release. So you'll go through 10 of those. Very good. All right. For the last exercise, you can take a towel at home and fold it up into thirds and roll it up into a roll. The roll should be about 6 or 8 inches thick. It could be a little thicker than this one. And we're going to put the roll under your knee. Okay. I'll have you bend a little bit more. There you go. All right. And you're going to just straighten your leg by lifting your lower leg. So you're kicking up into the air and back down. So 10 of these. Very good. And you see that she's just resting her leg on the towel roll. Okay? This is a demonstration of a car transfer after your hip replacement. Okay? Now, if you have a plastic bag, or you can just use one of the belonging bags that they have and place it on the seat, especially if your seats are cloth, that will allow the patient to turn while he or she gets into the car. Okay? Now you want to make sure that the seat is as far back as you can slide it. Okay? So you're going to slide the whole seat back, and then you want to recline the back of the seat back as far as you can. So now the car is ready. Okay? All right, so we're going to bring our patient to the car. You just walk right on up with the walker. Okay. And she's going to turn around and back up to the car seat. Very good. Okay. Just back up till you feel the car behind your legs. Okay. And once again, she has had a left hip replacement. So watch the left leg. Okay, so now you're going to reach back for the car seat and the dashboard. And a family member can help slide the leg out. So you can go ahead and start to sit down and just watch your head as you sit. And try to sit on the edge of the seat. Okay? All right. Now, the key here is not bending the hip past 70 degrees. So she's going to lean back as much as she can and pivot around to bring the leg into the car. And if you're the family member, you can just help to bring the leg in. Now lean back as much as you can as you bring the leg into the car. so that we do not pass 70 degrees. And then continue to pivot on around, helping to bring her leg over. Okay. And then on the way home, you can bring the back of the seat up to her comfort. Okay? And then to get back out, you're just going to recline the back of the seat back again as much as you can. She's going to bring the leg out of the car. And if this was the operated leg, I would just help to make sure she didn't bend it too far. You're going to lean back as much as you can as we bring out the other leg. Good, and stay leaning back as you scoot to the edge of the car seat. So hips out first. And once again, just like we practiced earlier, the left knee is going to be straight. Oh yeah. Just like that. And you can push from the seat and the dashboard to stand. One more note about the plastic bag. When you place it into the seat, you want to make sure that it is at least almost halfway back on the seat. The reason being that if you place the bag too close to the edge of the seat, that the patient may actually slip off when they sit down. So you need to make sure that if you use a plastic bag to help with pivoting on the seat, that the bag is at least halfway back on the seat. And really, you only need a plastic bag if the seats are cloth. Thank you for taking the time to watch the physical therapy video on joint replacement. Remember that physical therapy is the key to successful outcome after your joint replacement surgery. And thank you for insisting on University for your healthcare needs.